By the way, just real fast, I'm going to 4 minutes wrap this up. Lactic acid. Lactic acid represents what, guys? You can do a whole talk on lactic acid. It's crazy. You're right. So basically, when in a sepsis, I'm just talking. Obviously, there's many shocks. There's hypovolemic shock, anaphylactic shock, septic shock, cardiogenic shock. We're talking about sepsis, but any of the shocks are the same, like Jill said, lack of tissue perfusion. When you're not getting the tissue perfused, what's happening? You're not getting oxygen to the tissue, and if you're not getting oxygen to the tissue, you're turning off the mitochondria. Remember him, the mitochondria? You're turning off the mitochondria. For the Krebs cycle, holy crap, Krebs cycle, yes, Krebs cycle. You're turning off the Krebs cycle. And if you turn off the Krebs cycle, you're not going to be able to take the pyruvate into the mitochondria to generate all the ATP. You're going to be left with lactic acid, which won't get in, which only generates 2 ATPs. So we have a marker now, which is crazy, think about it, for cellular hypoperfusion. There's something called a cold hypotension. So a lot of elderly folks will walk around with a blood pressure of 160, or anyone will. Oh, they're 101, great. Well, no, their lactic acid's 3, that's not great. They are actually in shock. They're in shock because their lactic acid's elevated. So we have the blood pressure, the MAP, the systolic, it gives us an indirect hint. Oh, I think they're good, I think they're not in shock. The lactic acid is 3, or it's 2.9. They're in shock. We need to do something. We need to aggressively resuscitate them. They are in shock. That oxygen is not getting to some mitochondria, different tissues. Okay, does everyone understand it? That's just a real fast skinny. I must stop this. So I'm going to. And I'm skipping. There's some EMS articles about lactates and the importance of it. I was going to talk about ultrasound real fast. How do you know how much fluid to give? I apologize. So maybe sometime we'll talk about ultrasound and some of the things you look at it. Right?
I think we have a sepsis alert here. This gentleman has been a recent hospital admission for pneumonia. His vital signs on arrival were 80/40. His oral temp was 97.9, but his rectal temp was 103.5. I think we need to start 2 liters of normal saline bolus. What would you suggest for antibiotics?
His PO temperature was normal, but you knew the 15% false negative in PO temperatures and their rectal temperature. Why is he a sepsis alert? Let's see.
Who's the worst actor?
He has many service criteria. Okay. So should we activate the severe sepsis guidelines?
Absolutely.
Go.
We need a point of care of lactic acid. We need a point of care of lactic acid.
What's the point of care lactic acid? What is his troponin of the MI for his stroke deficit on exam in a stroke scale? What is his lactic acid of the severe sepsis?
His lactic acid was 3.24. His troponin was 2.5.
Okay. And then, going through this guy's labs, actually, this guy did not do too well. You can see his white, you can see he has renal injury. Just think of those pictures we saw. Not perfusing his kidney, right? Capillary leak. His white cell counts elevated. He has anemia. Yada yada. He goes through a lot of the stigmata of sepsis. He actually had a pneumonia as cause. So we get the pneumonia here, the white blood cells, capillary leak, damage. Then he goes systemic, and that's what happened to this guy. This is probably the #1 cause of having, well, this is the #1 etiology for severe sepsis shocks is pneumonia. The risk factors, obviously, if someone has comorbidities, poor lung, so forth, we can withstand a pneumonia like that. This guy with an ejection fraction of 15%, now he's gonna take a hit with the sepsis and is not gonna make it, and so forth. So, I wanted to talk about ultrasound in sepsis shock. Basically, you can get a real good measurement of the inferior vena cava. Ultrasound, look at it if it's 2 centimeters or not. I have some slides and videos, but I'll just show you guys sometime out there because that'd be wise this week. But there's time at the end, I'll show you the ultrasound images. Looking at someone's intravascular volume, if there's been enough fluid resuscitation or not. You can actually measure the IVC, whether it's greater or less than 2 centimeters, and see if they need more fluid